So for bovine tuberculosis, it's worldwide. It used to be very common, but it's much less common due to eradication programs. The majority of the EU is free. However, it's still endemic in Spain and Greece. The etiology, it's caused by Mycobacterium bovis and Mycobacterium caprae. They are gram-positive filaments and they're obligate pathogens. They are Zeal-Nielsen positive and have a very, very resistant cell wall due to all the lipids. For the epidemiology, they have a very wide host range. They affect cattle, swine, equine, carnivores, and sheep and goats. It can be transmitted in the discharges, saliva, respiratory, nasal, and they're shedding for months, and it can also spread in the milk. It's a chronic disease. There's very slow replication, and they are also facultative intracellular pathogens. The pathogenesis, the bacteria enters a body nearly all the time through an aerogenic route. It is then engulfed by a macrophage, and the macrophage then brings it to the regional lymph node. So normally, the lysosomes in the macrophage will destroy bacteria. However, since Mycobacterium bovis has such a fatty lipid cell wall that the lysosomes can't get to it. And this means the Mycobacterium bovis can then replicate within the macrophage. And then eventually the macrophage will burst, and then the Mycobacterium bovis bacteria will then spread. Once they leave the macrophage, this will then trigger TNF and gamma INF. And this, as a result, will attract giant cells and other macrophages. These giant cells and macrophages will then try and contain the bacteria by creating a granuloma or a tubercle. So if there's a good immune system, there'll be a proliferative lesion, which means it's well contained. However, if the body has bad resistance, there'll be exudative lesions, so it's not contained and there's lots of fluid. And if there's a balance between the immune system and the resistance, there'll be tubercles, which means it's controlled, but it's not killed, so the bacteria lives within the tubercle. So in cattle, we have 4 phases. Primary focus is when the bacteria enters into the body. Early generalization gets into circulation, and there'll be a lymphohematogenous spread. And this means that proliferative lesions will form in other organs. In this phase, we will see enlarged lymph nodes, as well as decreased milk production. So the clinical signs don't start in the primary phase, only in early generalization. In the post-primary phase, the bacteria is no longer in the blood and it's only limited to the organ that it's in. So we can see intracanicular spreading. This means that the bacteria will go from one lung up the canals into the other lung. For the clinical signs, we can see dyspnea, coughing, and nasal discharge. However, for the post-primary phase, it can also be in the udder, the intestines, and the kidney and the joints, but it's mostly in the lungs. And since in the post-primary phase it's only limited to one organ, this means that there is no enlarged lymph nodes, unlike the early generalization where we have enlarged lymph nodes. Post-primary phase is considered an allergic state. Exhaust phase is also called late generalization. This means that the bacteria will then spread to other organs once again. There can be fresh lymph node lesions, but the animals usually die as there's so many exudative lesions in the organs. Farm animals are not to be treated, and there's also no vaccine for farm animals. However, you can give the BCG vaccine to wild animals to help stop the spread. For diagnosis, we can use PCR, however, there is a regular shedding, and we can use ELISA, but there can be cross reactions with other antigens. So the organic tuberculin test is an immune response to an antigen. There is an tuberculin injection, and then see if the temperature increases, and see if there's clinical signs like edema and sweating. And then for the skin intradermal test, inject a bovine and avian purified protein derivative into the left side of the neck. And then after 72 hours, see if it increased by 4 millimeters. If so, it's positive. And if it only increased by 2 millimeters, then it's considered negative. And for Mycobacterium of pigs, the species are Mycobacterium bovis and caprae, Mycobacterium tuberculosis, and Mycobacterium avian, and also facultative pathogenic mycobacteria, which are found in the soil. So in cattle, the bacteria primarily enters the body through the nose. However, in pigs, it's orally. This is why in pigs, the primary complex is in the intestines, not the lungs. In cattle, the primary complex is in the lungs. So for Mycobacterium bovis, they can get diarrhea if it's affecting the gut, they can get limping and lameness if it's affecting the joints, and they can get respiratory signs if it's affecting the lungs. For the diagnosis, you can do a tuberculin test at the base of the ear and then evaluate after 36 to 48 hours, but it's not as reliable. For Mycobacterium tuberculosis, it's maintained by humans. These are the source of the infection. They usually get it from swill feeding without heat treatment. And it can occur in the gut, and there can be local lesions, and then there can be spread to the lymph nodes, to the liver, the lungs, and the joints. It is zoonotic. Reinfection of humans can occur through pigs. For Mycobacterium avium, this is an obligate pathogen in birds, and it's shed in the feces, and it can get into pigs through orally, and then there can be local lesions, but it's frequently asymptomatic. And the facultative pathogenic Mycobacterium are found everywhere. This is atypical TB, and they cause lymphademesis, and they're found in dust parasites, and they can only be diagnosed in the slaughterhouse. And for fowl TB, it's found in backyard birds or in zoos and wildlife parks. It's not found in large-scale poultry farms. This is because the disease takes a long time to develop, so only old birds are affected, and on large-scale poultry farms, the birds are killed young. There are 3 species: Mycobacterium avium, which is found in all birds. Then Mycobacterium tuberculosis can be found in parrots or caged birds living beside humans. And then Mycobacterium avium sylvaticum is found in wild birds. So the bacteria enters the body orally, and then it gets to the gut, and then there's intracellular macrophages, which in the lymphoid tissue, and then they can get into the blood, and then there's generalization. So they can go to the bone marrow, the liver, or the joints. Incubation period can take years, but if it's in the gut, they can get diarrhea. If it's in the bone marrow, they can get anemia, and if it's in the liver, they can get jaundice, and if it's in the joints, they can be limping. In birds, it's unique, as there can be repeated bacteremia. There's no treatment, you just have to stamp out. And the same with prevention. The vaccine is not effective. For diagnosis, you can do PCR, ELISA, but plate agglutination is the best, and saying you can do a tuberculin injection into the wattle, but it's not reliable.